A 7-year-old boy presents to your pediatric clinic complaining of diminished visual acuity. He was born in Southeast Asia and immigrated to the United States 1 year ago. On physical examination, you find that he has lenticular dislocation. On ophthalmologic examination and abnormally long fingers. I think without even reading the case, we can say that it is homocystinuria. So his concerned parents also report that he was far behind his peers in terms of developmental milestones and seems to suffer from some mild mental retardation. While you await an emergent pediatric ophthalmology consult, you order serum as well as urine studies, expecting to be elevated serum methionine and urinary homocysteine levels, where you suspect that the patient will need high dose of pyridoxine, cysteine, folate supplements, and a methionine restricted diet. So this is a case of homocystinuria. This is an autosomal recessive disorder caused by the deficiency, or we can say defect, in the enzyme cystathionin synthetase. So cystathionin synthetase or synthetase is the enzyme, or we can say that whenever there is a deficiency of this enzyme, the disorder which can be caused either by a deficiency or by a decreased affinity of cystathionin synthetase for the pyridoxal phosphate, which is vitamin B6, maybe both. So the pyridoxal phosphate, which is vitamin B6, is a cofactor for the enzyme called as cystathionin synthetase. Now, if you see the pathophysiology of this case, homocysteine is converted to either methionine by the enzyme called as cystathionin synthetase along with vitamin B6. So whenever there is a defective cystathionin synthetase, homocysteine will accumulate, and we know that the homocysteine is toxin specifically to the vascular endothelium. So that's the reason the buildup of homocysteine, which is toxic to the vascular endothelium, leads to atherosclerosis and increased platelet adhesiveness to the vessel wall, and thus increased incidence of thrombus formation. We'll repeat once again, because of the accumulation of the homocysteine. Homocysteine is a toxin mainly to the vascular endothelium that leads to increased atherosclerosis and increased platelet adhesiveness to the vessel wall, and thus an increased incidence of thrombus formation. Not only that, elevated homocysteine levels also interfere with a normal collagen formation. So because of this, there will be ocular as well as skeletal manifestations, which can also be seen in this case of homocystinuria. What are the clinical manifestations? What we can see here: morphonoid appearance with elongated limbs, and homocystinuria can cause mental retardation, neuropsychiatric dysfunction. But remember that the osteoporosis, morphonoid appearance, lens dislocation, thromboembolism. Remember these 4 words. If you see the combination of all these 4, then it should be homocystinuria in more than 90% of the cases. Sometimes even if they don't give you morphonoid appearance in your exam, but just by seeing osteoporosis, which is mainly because of defective collagen formation, lens dislocation is also because of the same, that is ectopia lentis. Along with that, the disorder, when these two, osteoporosis as well as lens dislocation, when they give along with the thromboembolism and a coronary artery disease, I don't see any other case where you can say this. It should be a typical case of homocystinuria. So that's why you write down the triad of this. And lab findings is evident with the increased methionine in serum and excess homocysteine in the urine, and the enzyme deficiency whenever it is there, the treatment is like decreased methionine and increased cysteine and folate in the diet. That's what you have to do. And whenever there is if there is an enzyme deficiency, treatment is separate, and if there is a decreased affinity for the enzyme, treatment is separate. What is the treatment if there is an enzyme deficiency? Is decreased methionine is a very, very important. This is a point which is related to question. Decreased methionine if there is an enzyme deficiency, as well as increased cysteine as well as folate in the diet. And if the homocystinuria is because of decreased affinity of the synthase for pyridoxal phosphate, then remember high dose of vitamin B6 in the diet. Okay. And not only that, homocystinuria can also result in response to that of the deficiency of vitamin B12. This is the case of homocystinuria. For the treatment enzyme deficiency, if homocystinuria is because of enzyme deficiency, then decreased methionine and increased cysteine and folate in the diet. That is the treatment of choice. In that you have to underline decreased methionine. And if it is because of, which means if the homocystinuria is because of the decreased affinity of synthase for the pyridoxal phosphate, but not because of the deficiency of the enzyme, then high dose of vitamin B6 in the diet. Okay, this is what is the treatment.